IVM.
Hello and welcome to the Habit Coach podcast. I am Ashdin and Dr, your habit coach, and with us for the second time we have Dr. Raashi Khatri Punjabi. And if you haven't heard our first episode, please do go and listen to it. It's all about understanding pain because she is a doctor specializing in pain. She's one of my closest friends because we've understood and we vibe so well on subjects like this, and we take, understanding healing from a body perspective, from a mental perspective, from a spiritual perspective. And there are so many different aspects to it. So it's always fascinating talking to Dr. Raashi. So Dr. Raashi, welcome to the podcast for a second time.
Thank you so much, Ashdin. I'm super excited to be here a second time around to talk to everybody about headaches, migraines, and any pains of the head, face, and neck. We're hopefully going to give people tools that can help them live a more pain-free and a more wholesome life. So, yeah.
Absolutely. Well, the last podcast was all about understanding pain and knowing that it is not something that's so scary, that is debilitating. This one is more about understanding headaches, migraines, and ways in which we can actually do something about it. Because almost all of us will have somebody in our family that has been plagued by this, if not us, but, have these kind of pains in our body or in our head.
So, Ashdin, actually, headaches are the most prevalent symptom on planet Earth. Almost 95% of human population that is living on Earth right now have experienced some or the other headache at some point in their life. So it is the single most common binding symptom to the entire human population.
So there is 5% that has never had a headache.
There is literally, sometimes I go into an audience full of 100 people and I'm like, how many of you all have never had a headache? And I may see like that one bichara finger going up. And I constantly ask them, are you unmarried? And
or do you not have a head? I think do you not have a head is probably...
We all have a good laugh about it. But even then, I'll tell you why even that misconception arises. Because when I ask people, where is your head? They most often point to the area above their eyebrows to the top of their skull, right? So you identify as pain in that area only as a headache. But your head is your entire globe of your skull, which is above your neck. So technically, any pain in your entire skull, that entire round part that sits above your neck, is your head. The moment I change this definition, it suddenly goes to 100%, because there's not even one person who has never not experienced some pain, even if it's short lasting, in that area of the body. And unfortunately, it is for headaches, we all become self-prescribing doctors. My aunt's neighbor had migraines, so I think I have migraines as well. How do you look after it? Nothing. I go and take the strongest painkiller my chemist is able to give me, and that helps me generally. So a lot of people for headaches would become doctors themselves and ply themselves with pain medication rather than reversing it by figuring out the root cause. And we are here to discuss exactly that today. How does one reverse migraines? How does one reverse any kind of headache without having to stuff your body with unnecessary medication?
Lovely. So headaches could be anything neck and above. Correct?
Any pain.
Is a migraine something specific? What is a migraine?
So let me describe to you what a migraine is. But I'm going to put in a little caveat over here. When we were younger, when there were not that many printers and laptops that we had access to, like the children of today have, we would, for college, go to these little Xerox walas, and we would give them some notes, and then they would do Xerox and give it back to us. Technically, what we were doing is photocopying. But because the machine is so famous, we call photocopying Xerox. Exactly like that, migraines are a type of headache. But because migraines are so common, most people think that every headache is a migraine. So guys, not every headache is a migraine, but migraines is a small subset of a type of headache. And even migraine have further branched out into types of migraines. So knowing that, you suddenly recognize that, I have been taking an X medication for headaches, I may not necessarily have migraines. I may have a type of headache similar to migraines, but which is way easier to treat if I would have recognized what it was.
Interesting. Very interesting. So all migraines are not headaches, and that's what
all
headaches are not
migraines, right?
So migraines is now just used as a catch-all term.
It is,
correct.
Unfortunately.
So what is a migraine then? Is there something specific that a migraine is?
Yes. So I'm going to describe to you what it is that a patient feels when they have migraines, and then we can also talk about some of the other common headaches which are not migraines but which mimic migraines, right? Which are very commonly, people believe that they are migraines. But first, let's
And do they have cool names as well?
Very cool names. I can't wait to tell you about them.
All right, superb.
So, migraines are headaches which are felt on one side of the head, but can also be felt on both sides of the head. They are felt predominantly in women, but are also prevalent in some proportion of men. But what marks a migraine is that it's characterized by a throbbing, pulsating, almost hammer-like feeling, which is felt maybe going from the temples to the back of the skull, not at the base of the neck, just the top back of the skull, and is constantly felt as a pound, 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 pound. And most people who suffer from migraines would prefer then at that time to go and enclose themselves in a dark, cool room. So they would just lie down without any lights, ideally without any sounds, because sounds bother you a lot during migraines. Lights make you feel extremely uncomfortable. Eating something can make you feel extremely nauseous, can make you sometimes even throw up. And people associate that their migraines start because of certain smells or certain foods or certain fluctuations in their body. Now, all of these are correct, but migraines are not this big monster which is untreatable as people have thought for many, many years. Migraines are curable. There are correct treatments that can be used to even prevent migraines if you know your patterns, or even abort a migraine. And abort migraine is like abort mission. A rocket is about to launch, but you say abort mission. So the rocket doesn't get a chance to shoot off into space. Similarly, migraines are completely curable. And this seems unbelievable. Like a lot of my patients walk in and tell me that my migraines are older than you are. Like my older patients would be like, you are too young to be treating my migraines. And I'll be like, give me a chance. Let's figure out what's going on. Only to recognize that they don't have a pure migraine, but a subset that can be treated way, way easily. So migraines can be very debilitating because people who suffer from migraines, often it makes them feel like a shadow of themselves, and they're constantly watchful of when they are going to get a migraine. And it can be extremely painful as well. So every movement that you make would lead to you would feel like a hammer going on in your head. But I actually want to tell you what a migraine is in a simpler way. This is what a patient feels. But let me make medicine uncomplicated and tell you what actually happens to the body when somebody has a migraine. Okay. So for everyone who's listening in today, I want you to think, first of all, honor your own body. Just feel your body, and let's also feel our head. So if you were to now knock on your head, you will realize that there is a hard casing that is protecting your brain, correct? So your brain is actually this squishy, very intelligent organ that is protected by the hard casing of your skull. But like every part of our body functions because it gets good oxygen and good amount of nutrition from blood supply. And that same blood supply, as it passes through the pipes which are encasing all our organs, takes away the carbon dioxide and any toxins that our body wants to release. So even for our brain receives the blood supply from arteries, which are like pipes, like garden pipes, and all the toxins are taken away by veins. And these are linked, right? There is the arteries become into small capillaries that again become into veins. Now, your capillaries is where this exchange happens. Now, in our body, think of these blood vessels exactly like a garden pipe. Imagine you have a 1 meter garden pipe, and in every 1 minute, 1 liter of water is able to pass through this garden pipe. Now, for migraineurs, for people who suffer from migraines, there is a response in the body. Now, this response could be to a hormonal change. This response could be to a BP fluctuation in the body. This response could be because of dehydration in the body, which could also lead to BP fluctuations. But basically, this response is marked by the thickness or the diaphragm or the circumference of that pipe becoming suddenly narrower. So suddenly, the space that your pipe had available to carry that 1 liter of blood in 1 minute has become so much smaller because the capacity has possibly halved. So possibly at that point, only half a liter of blood can pass through instead of that 1 liter which was going earlier. So for your next minute, you have half a liter surplus and you have the oncoming 1 liter. And the next minute, for the third liter, you have 1.5 liter surplus and the oncoming, correct? So eventually, your tap or your pump house is going to start putting pressure against the walls of the pipe. That's exactly what happens. Your heart pumps, boom, 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 boom. And what you feel is the pressure of that boom, 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 boom of that blood coursing through your blood vessels, producing a throbbing, a hammering, or a heartbeat like headache, but in your head. And your brain actually is your organ that allows you to utilize all your senses. So your sight, your hearing, your taste, your touch is all augmented by your brain. So migraines, therefore, also give you a heightened response to your senses. So migraines are neurovascular headaches. They're nerve and blood headaches because suddenly some amount of light which you were normally seeing will make you want to shy away. You'll want to shut your eyes. The normal noise of your child screaming will seem like knives in your ears. The normal acidity that we all have because of acid production in our stomach will feel like nausea, and you will get to a point where you'll want to throw up. So what you choose to do is cut yourself off from all sensation. So you choose a dark, cool room to pretty much hibernate in till your body self-regulates and opens out the circumference of the blood and allows for the blood flow to get better. Sometimes this can take from 4 to 7 days even, Ashton.
Oh, wow.
So it can be extremely debilitating. And during that time, even if you smell, say, what has been used to mop your floors, it can make you feel as if you're smelling something really toxic and can make you feel extremely uncomfortable. So people have heightened sensation along with the headache, which can completely throw you off, especially for women, because hormone response triggers them. So at the same time, they could be having their period or they're ovulating or right before their period because their body is already going through the changes this happens. So it can completely take away from your quality of life for those 4 or 5 days, if not more.
That is crazy. You explained it so beautifully. Your heartbeat is causing these migraines in terms of the boop, 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 boop. That's the first fascinating thing that I learned. As a joke, I was just thinking, so basically if you want to cure a migraine, stop the heart. But like, I think that is a bad idea. We should
Very
not be
bad
doing
idea.
that. Maybe we should not be doing that. But the second interesting thing was that it is not the smell of paint that caused your migraine, but it's the fact that you had a migraine plus the paint that just heightened everything up. And that's just what you're feeling. You might not have an acidity issue. So taking your acidity medication might not necessarily be the way to handle it, but to figure out that it's the migraine that is making your acidity feel 10 times worse than what probably is. I think this is a big penny drop moment for me and for our listeners, because normally we just think of it as, oh, this caused this caused this. Not realizing that's probably the way that you said it, your neurovascular.
It's a neurovascular headache, yes.
Neurovascular headache. Yeah, because your neurons, which is the senses, plus the way that your body is adapting to it. Sorry.
the vascular is your blood vessels. Unfortunately, because you don't enjoy these headaches. Nobody enjoys such a debilitating headache. So people then cut out things from their life thinking that those may have triggered it. So I sometimes meet very young girls who will tell me, I've not eaten a chocolate in 3 years, and I have not had red wine in 3 years, or I haven't had cheese, because you believe that these have worsened it for you. Well, there are some triggers, some food triggers, like monosodium glutamate, which is basically in Chinese food, and it was believed to be a very big trigger. Only now we have realized that soy or MSG increases the salt content and impacts the blood pressure. So basically, you make thicker blood, which starts this entire process. So rather than cutting out the Chinese from your food, or rather than cutting out the chocolate or the red wine, if you choose or you want to have those things, it's better to figure out, why is my body going into that response where my blood vessels, or basically why are my arteries and veins fluctuating in the size of the circumference in the cross section.
And what's interesting, and correct me if I'm wrong, because I'm not a doctor, so I'm just guessing this, is that this is happening at a systemic level. All over your body, your capillaries are closing down. It's not just that's taking place in the brain, but you're feeling it in your brain more than you are elsewhere.
It is not so much systemic. For some reason, we see it more in the head. But you're right. We have also seen patients with... So migraine, the term stands for this neurovascular impact on the body. So we have seen patients with stomach migraines, with ocular migraines, with facial migraines, where they feel that same kind of throbbing, but in their face. Or I had a patient who was a gentleman who was having that same kind of throbbing in his stomach. So it's very interesting that the body responds to what it doesn't see as its most optimal state by producing such a dramatic reaction in terms of pain, to tell you that something that's going on inside is not working. So don't cut out your triggers, because that's not going to really help you. Figure out the response in your body and reverse that.
Superb. This migraine was one huge learning for me, and I'm sure for the listeners. Now, tell us about the other kinds of headaches that you were saying, and the very cool names that they have.
So excited. So there are two common headaches which are very similar to migraines. Out of 100 patients who come to me complaining of migraines, I realize maybe 6 are actual migraineurs. And the remaining bulk of the patients are actually undiagnosed from these two types of headaches. Okay. So I'm going to talk about one first and then the other. We'll start with what is called cervicogenic headaches. Now, these headaches are also very wrongly called tension type headaches. Actually, it's a good name, because tension type headaches refers to the tensile forces in the muscles of our body. But most of us think of tension type headache as being as a product of stress or depression or an emotional imbalance. But these headaches actually start from the neck, because the muscles that are supporting your head go into spasm. Now, what a patient will come in complaining to me if they have tension type headaches is that, yes, they also have similar one-sided headaches like migraines, or it may be two-sided as well. But primarily, they will also feel the pain at the top of their head, possibly at the back of the head, from ear to ear, like a band. And that pain often goes down or refers into their hand, into their shoulder, also at their shoulder blades, maybe be felt in their fingers as well. But the quality of the pain will always be deep, dull, achy background pain. So there's this constant tightness, there's this constant feeling of weight which they're feeling in this area. So out of 100% of the time that they may have a particular headache, this kind of headache is more continuous in nature. So most of the time what you'll feel is this deep, dull, achy pain. But when it gets really bad in quality, or if you have irritated it, it can also have a mild throbbing variation, especially during movement. But primarily, The location of this is at the back of the head. A lot of people confuse it for migraines because of the intensity, because it's really, really bad. And because you may also have nausea related to this kind of headache. You may also want to lie down in this kind of headache, right? Now, the causative, this is what a patient may feel. But the causative factor of this kind of headache, what we call cervicogenic headache or tension type, is not tension. But to simplify it, our head, our skull is 8 to 10 kgs without hair, without glasses, without earrings. Just our plain skull is 8 to 10 kgs, and it is supported in our body by our spine, which starts behind our neck and goes all the way till our buttocks. So imagine if I were to put a bowling ball on top of a broomstick. Technically, it shouldn't stay. It should fall by the laws of gravity and physics. But our head continues to stay upright because our body is supported by very long and strong muscles which start from mid-chest, from our arms, from mid-shoulder. They go upwards, crisscross at our neck like layers of an onion, and then go and take final anchorage or latch on to the top of our head. So your head is like a needle point that allows for all these threads of muscles that are coming from far away, which meet at your neck and then eventually take support on top of your head. So if I ask you to move your head on one side, you'll actually feel the muscles stretching from your arm, across your neck, behind your ear, to the side of your head. Now, if I ask you to do it on the other side, the original side will feel contracted while the other side is now stretched open. So your body is constantly working with 60 muscles to just keep your head upright. Now, these muscles are supposed to be loose, flexible, elastic, mobile. But for some reason, and there are many reasons, we'll go into them in a little while, but for some reason, if these muscles go into spasm, if they get knots, if they get tightened, and the easiest way to figure out if you have them is actually feel your neck and see if you have those tender spots or if you have those little lumpy points that you like to get massaged on. Or people call them knots even. But if you have knots, it basically means that your muscle, if I were to oversimplify it even more, has a knot in it. So what was supposed to be, say, a 10 centimeter thread, if it had a knot in it, it would become into a shortened muscle, correct? It would become into a shortened thread. So this thread of your muscle is now a shortened version of itself and a stiffer version of itself. And if you do anything, any activity to aggravate that knot, the pain will literally shoot out and spread till where the muscle is attached. And unfortunately for us, these muscles are all attached on top of our head.
Our head.
So what you'll feel are temple pain. What you'll feel is temple pain. Pain possibly in your jaw. When you wake up, you'll feel tired in your jaw. You'll feel pain right behind your ear. You'll feel it at the base of your neck. And you'll feel it going till wherever that muscle is attached. So it could be the front of your chest, into your arm, into your shoulder blades. You know, and our muscles are so beautiful. They are attached to each other. So imagine a yellow thread attached to a green thread, attached to a blue thread. If I make 5 knots on the yellow thread, it'll actually pull the green and the blue thread.
The blue, correct. Yes.
So a lot of people who have these kind of headaches will also have some or the other hip pain, maybe pain going into their leg. Maybe not bothering them too much, but they'll see these little lumps in their muscles and they'll feel an overall tightness in their body. And what will they end up treating themselves for is migraine. But what do they actually have is myofascial, which is deep layer of muscle, cervicogenic, which is cervical means neck, genic means genesis or birth. So the birth in the neck headaches. So the headache that took birth in the neck.
In the neck. Ah, beautiful. Beautiful. So we have the migraines, which are completely different from this, which is muscle related. But they feel
the same.
But they feel the same. Superb. Okay, so Raashi, the third one. What is the third one?
So the third type of headaches, which are very often mistaken for migraines, are known as, very wrongly known as, or mistakenly known as sinus headaches. So basically, whenever we all breathe in, the air that we take in has a lot of pollution, particles, dust in it. But our lung cannot take all that garbage going inside. So the universe, when it created the human being, gave certain filters to us in our nose that catches onto these particles so that we don't ingest them, so that we don't take them inside. A lot of times, if there is any kind of airway compromise, if there is a deviated nasal septum, if there is a polyp, if there is an allergy, if there is sinus issues, chronic sinus issues, your body is not able to adequately take in air from one of your nasal passages and is also not effectively able to throw out the garbage from that same nasal passage. Now, all that garbage actually collects around your eyebrow and below your eyebrow. I'm putting it very simplistically over here for the benefit of everyone who's listening it. But what you'll feel now are headaches in the temple, around the eyebrows, possibly behind the eye, and will be felt as a deep, dull, throbby headache, often accompanied by the neck pain as well, because those who have this kind of sinus issue will often rely on mouth breathing and sit in a forward head posture and also compromise their neck. So they'll end up having a combination headache over here. But Ashdin, these will feel again like migraines. These will also have a component of your cervicogenic headaches, but they will be in terms of treatment completely different than your migraines. Unfortunately for us, if I give a strong painkiller to all three, you will land up switching off the pain for 4 hours, because it's exactly like you have a problem in, say, your phone, but you go to the tower and switch it off. So you're switching off your brain from recognizing where the pain is coming from with the painkiller. But what you need to do if you want to completely reverse this pain for life is to address the root cause by looking after it, by diagnosing it either as a migraine or as a cervicogenic pain or as a frontal sinusitis headache.
Beautiful. Wow. So the issue is that we are clubbing all the pains together. We're just treating the pain aspect, not understanding that there are actually different root causes, and we can actually deal with these root causes.
Yes.
Separately. Raashi, what are habits that people that can use to make sure that they never have these kind of headaches, or if they have headaches, how do they get rid of them?
So we'll break up the habits into these 3 different types of headaches, which will make it easier for everyone to understand. These are great habits for anyone to incorporate, even if they don't have headaches or even if they don't know what kind of habits they have. Number 1, make sure that you're hydrating enough, because 80% of your muscles is water. So getting that kind of substrate into your body is very, very important. Oxygenation is a very important part of our body, as always. Recognize what your body is trying to tell you. I have given you enough tools today to at least be able to figure out, do I have a throbbing headache? Do I have a deep, dull, achy headache? Where is my headache? Is it on the side of my head? Is it on my eye? Is it at the back of my neck? Because you'll immediately know what kind of a headache you have. And then look at finding the habits that can support you. For example, if you do feel that you have migraines and you're absolutely sure about it, keep the habit of writing down when your periods are expected if you're a woman, or if you're a man, make a diary, because these are cyclical headaches. They come in patterns. You will be able to predict those headaches. And once you can predict it, you can actually reduce your sensory overload before the particular date. So you can actually wear blue light cutting glares or glasses when you're using your computer, so that the light from your computer cannot sensitize your ocular vision. You can start recognizing that these particular MSG foods are triggering me right before my migraine, and yes, I'm going to get it on so and so date. If there are women who know that they have hormonal fluctuations, make sure that you are particularly using movement or exercise which is focused at core building and allowing for less visceral fat accumulation for you. Recognize your body, because that will help you as well. Definitely work knowing what your triggers are from sensations point of view, and eliminate those only for those few days and not for the rest of your life. Also recognize that there are treatments available for prevention as well as aborting these headaches, which I'm happy to help you out with. Now, if you do have cervicogenic headaches, Understand your body and figure out, do I have cervicogenic because I'm a mouth breather? Do I have cervicogenic headaches because my profession puts me at a certain position that triggers off my neck? So for example, diamond assorters, surgeons, dentists, writers, people who do bodybuilding, hairdressers have certain professional movements that can trigger off a muscle. Find that if that's the root cause. Please see if your headaches, your temple headaches are coming because you have the habit of grinding or clenching your teeth, because the muscles on your cheek are also attached to your temples and can trigger that off completely. Make sure that you get into the habit of doing a good cool down and warm up during your workouts, because that is key to preventing muscle injury. If you have any kind of incidence of whiplash, make sure you get it evaluated. By whiplash, I mean either work that puts you in jerky movements, or if you're a car driver, a NASCAR racer, anything that puts you at a greater risk of neck injuries, reach out and find ways to support your neck. If you're a long distance driver for work, make sure that you're finding the right neck support. That's a very good habit to incorporate. Make sure that your nutrition is well looked after. So your magnesium, your B12, the kind of food that you require to sort of support your body for muscle healing is something that you need to look into very clearly. Now, if your headaches are related more to, say, your frontal sinus issues, figure out what is the nasal compromise that you have, because without that, you're not going to be able to reverse it at all. Now, we have realized that there's a very strong correlation between your gut inflammation and your headache response. And this rise is the same for all three of these headaches. So please recognize what are the foods that you're intolerant to, and what are the foods that do not allow your body to be the best version of itself. It may be different for different people. For you, it may be a rice intolerance and not a gluten intolerance, but you need to know your body, experiment to know what it is that is allowing your gut to be strong. Your gut is your second brain. It is the source. It is literally like a forest in your belly that allows your body to absorb vitamins and also allows you to be in the most comfortable, healthy status that you can be in. So looking after your gut is key to headaches as well. And overall, genetics is something we can't control. Your gut is something that you can control, and your epigenetics or your surroundings is something that you can control. So whether it's pollution, in terms of even emotional pollution, toxic people, recognize what's around you in your environment. So if it's bad sleeping habits, if it's bad, even you maybe being bitchy about somebody which is making you compress your muscles more, recognize your behavior patterns and reverse those, because that will really help you.
Wow. Guys, this is why I love talking to Dr. Raashi. You just realize in the last 7 minutes, I asked for 3 habits. She gave us 37, right?
Much.
This is just brilliant, right? Because, you covered so many aspects and it just shows how in tune you are with the subject and understanding understanding the human body and getting people healed in that. So I absolutely adored that. Yes, there were about 37 habits. I was noting them down because, we could have created 2 months worth of habit coach content from them, but probably we will, who knows? So guys, please join me in thanking Dr. Raashi for joining us on this Habit Coach podcast. It was absolutely fantastic having you here, Raashi. And how can people get in touch with you if they want to either consult you or have questions on what we discussed today?
It's always a pleasure coming on and talking with you, Ashdin. I love the kind of work you do, and I hope and pray that you keep inspiring more and more people. Anyone who wants to get in touch with me for any help that they may need regarding their headaches, you're welcome to reach out to me at PD Hinduja Hospital, Mahim. I'm also available at Mind Temple, Juhu. And in the current pandemic, we are also offering online consultations. You can email me at info@ofpindia.com. And I'm available on all the social media handles as Doc Raash, DocRaash. Follow me and you'll get lots more information there as well.
Love it. Doc Raash, thank you so much for joining us on the Habit Coach podcast.
It was my pleasure.
Love it.
Thank you, Ashdin.
All right. Thank you.
If you like this podcast, don't forget to check out other interesting podcasts on the IVM network. You can listen to us on the IVM podcast app, or ivmpodcast.com. You can also follow us on social media. We are at IVM Podcasts on Twitter and Instagram. If you want to reach out to me, I am Ashdin Doc on Twitter and Instagram. You can find lots more information on my website, awesome180.com, or check out different content on my YouTube channel called AWESOME180. That's Awesome 180.
I hope you enjoyed that show. If you aren't following us on social media, please do. We're IVM Podcasts on Twitter, Facebook, and Instagram. I want to let you all know about 2 new shows that we've launched this week. The first one is Millennial Athlete, hosted by Tanvi and Shlok. Both of them are, they spent their life playing badminton, and they know a lot of athletes, and they want to talk about the particular challenges that athletes face. Really, really great conversations. Do definitely check that out. The other show that I wanted to mention to you that we launched this week is Naan Curry. Naan Curry is a show about food and the history of food and the economics around food and its consumption and all that kind of stuff. It's a really, really interesting conversation. It's hosted by Sadaf, Zenatha Chef and former MasterChef India finalist, and Archit, who is a researcher who writes on behavioral science and economics. Definitely worth checking out. Besides that, we had a great week as always, right? Great stuff on all the normal shows. Do check those out. But with that, hope to see you again next week.
Whether you're an established sports person or a budding one, or simply a sports enthusiast, join us, Tanvi and Shlok.
We are 2 passionate pro badminton players talking policy, mindset and everything sport.
So tune in to the Millennial Athlete every Monday.
Only on the IVM Podcast Network.
Trust us, it's gonna be lit.